He's a constituent of mine from Oakwood Hospital and from Dorman Medical Center in Dorman, Michigan, my hometown. Doctor, it's a pleasure to welcome you. Thank you for being here. As members of the committee well know, I've long believed that the FDA does not have the people, the funding, or the authorities it needs to properly oversee an increasingly global drug supply chain. That has been supported by testimony and evidence submitted in hearings before this committee for a number of years. So in support of that posture, I would like to direct my questions to you, Mr. Germano of Pfizer, and please answer to the following questions, yes or no. Do you agree that both FDA and industry have a responsibility to ensure the security of our drug supply chain, yes or no?
Yes.
Do you agree that the knowledge of your suppliers is important, yes or no?
I'm sorry, the knowledge of our suppliers?
Your knowledge, acquaintance, and experience with them as to their behavior and the quality of the goods that they are delivering you. Yes or no?
Yes.
Thank you. There are no traps here.
Okay.
I want you to
just want to make sure I understand the question.
I just give the answers and you will be satisfied, and so will I.
Okay.
Does Pfizer have systems in place so that they can know and understand their suppliers and monitor the manufacturing quality of these suppliers? Yes or no?
Yes.
Should all companies making drugs in the U.S. know their suppliers and have quality systems in place there to assure that they're getting safe supplies from their suppliers? Yes or no? Now, I must assume, however, though, that there would be some instances where additional help would be needed by American suppliers, i.e. in the heparin case, where raw materials or components for the heparin were clearly not safe, and the result was American manufacturers were put at risk. Should FDA have additional authorities to provide that kind of support for American manufacturers? Yes or no?
Yes.
No traps here.
Yeah,
I want you to be comfortable. Should the companies be using risk analysis to target safety risks? Yes or no?
Yes.
And that's not on a standalone basis. Obviously, they would have to use other things. Now, these are for Dr. Wheadon of Pharma. Doctor, I want you to be comfortable with these, and I'm not trying to lay any traps for anybody here. I want to focus on inspections. Do you agree that requiring FDA to conduct comparable inspections of domestic and foreign drug facilities is important to ensuring a level playing field for our drug manufacturers? Yes or no?
Certainly the answer is yes, based on...
I'm sorry?
Certainly the answer is yes, based on ability to assess risk.
I have very limited time, Doctor, and
I understand.
I beg your cooperation here. Do you agree that conducting comparable inspections of domestic and foreign facilities is important to public health? Yes or no?
That is a yes.
And of course, it's important to the fairness with which we treat our manufacturers. Is that not so?
I think it's important to be fair across the board.
Now, do you agree that FDA needs adequate resources to conduct comparable inspections of domestic and foreign drug manufacturers? Yes or no?
I believe the agency should have adequate resources.
Now, if FDA does not treat manufacturers, it is alike, it is very liable to be unfair to U.S. manufacturers because of its inability to impose equal burdens upon both domestic and foreign manufacturers who are outside of our borders and outside the capabilities of FDA to reach them. Isn't that so?
I think FDA has the ability to impact foreign manufacturers if they're importing drugs into the U.S.
But you would advocate that FDA do have such authority.
I think FDA has that ability to impact those manufacturers, and they should.
Please answer my question.
And they should, yes, sir.
Okay. Does a prescription drug user fee agreement currently provide resources for pre-approval inspection? Yes or no?
Yes, it does.
Does a prescription drug user fee agreement currently provide resources for any inspections beyond the pre-approval inspection? Yes or no?
That's a qualified yes, it does.
Qualified. But it should be yes, shouldn't it? Because FDA should have that authority, should they not?
But FDA has the ability to inspect facilities with resources.
That's one of the questions we're going to be going into,
Okay.
Doctor. The generic drug user fee agreement provides additional resources for FDA to conduct GMP inspections of both domestic and foreign drug facilities. Would you support providing similar resources to FDA for inspections of facilities manufacturing innovator drugs? Yes or no?
No.
Do you agree that a risk-based inspection schedule for domestic and foreign drug facilities, based, for example, on compliance history, time since last inspection, volume and type of product, would allow the FDA to better target the use of their resources?
Yes.
Yes or no? One obstacle to ensuring comparable inspections of domestic and foreign facilities is the lack of complete and adequate information that FDA has on drug manufacturing establishments. Do you support requiring domestic and foreign drug manufacturing facilities to register with FDA to provide a unique facility identifier and to list their products? Yes or no?
I think that is one I'd have to come back to you with further comment on. I'm not prepared to give a specific yes or no on that one.
Very good. One question then. Why is it that pharma does not support additional resources for GMP inspections?
Well, if this is more than a yes or no, right?
It's a fairly simple question. I know you have a fairly easy to understand answer.
Right. So as you correctly point out, Representative Dingell, the PDUFA fees that the innovative industry presently pays goes towards pre-approval inspections. When an inspector goes into a facility, be it domestic or foreign, they don't only look at the product that is under consideration for approval. They look at the system of that manufacturing establishment. So a GMP inspection is carried out in the context of pre-approval inspections.
Am I somewhat dense in not understanding why we would want to see to it that FDA has the authority that it needs to carry out its responsibilities in the best way possible?
We certainly agree that FDA should have the resources to carry out their responsibilities very efficiently.
I note, Mr. Chairman, I have exceeded my time by 3 minutes and 5 seconds. You have my thanks and my apologies.
Chair thanks the gentleman and yields to the gentleman from Illinois, Mr. Shemkus, for 5 minutes for questions.
Thank you, Mr. Chairman, and